Good morning, everyone. We can get started now. Thanks for joining us. First and foremost, I'd like to thank you for taking the time to join us this morning. I know it's a very busy time for all HR and finance professionals as we head into the latter part of the year, so we appreciate greatly your time and attention this morning. My name is Mary Kay Wagner, Client Executive at the Fidelity Group. Today, we're going to be talking about an important topic concerning engaging and empowering your Medicare-eligible employees. Before we get started, I'd like to go over a few items to help you maximize your participation in today's event. All phones have been muted. You'll have an opportunity to submit text questions to today's presenter by typing them into the questions pane of the control panel. You may send your questions at any time during the presentation, and we'll collect these and address them during the Q&A session at the end. Before we begin our presentation, I'd like to do an update on the credibility of your medical plans. You've been receiving notices from us at the Fidelity Group for the past several months, notifying you that there have been some changes to Medicare plans which could impact the credibility of your group plan. The Inflation Reduction Act of 2022, enacted by Congress in August of 2022, includes several cost reduction provisions affecting Medicare Part D plans. For 2025, changes were made to the Medicare Part D plan design, including a $2,000 out-of-pocket limit on medications. These changes have increased the richness of the standard Medicare Part D benefit, setting a higher minimum standard that group health plans will need to meet for their prescription drug coverage to be considered creditable. We've been notified recently that for most group plans, the change in credibility status has been delayed until 2026. So what that means is that if your group plan is considered creditable in 2024, it will most likely retain credibility for the 2025 plan year. The Fidelity Group will continue to update you on any changes, and our speaker will talk a little bit more about the Inflation Reduction Act during her presentation. Today, we're privileged to welcome our presenter, Kathy Hirko, founder and president of the CAS Company. Kathy is one of Ohio's leading experts on Medicare. You might have seen her featured on WKYC or WEWS on Sunday mornings, or heard her on WTAM radio. Knowing that Medicare can be an overwhelming and confusing maze, Kathy and her team of 23 agents work with people to find them the best plans that suit their needs. Fidelity has had the pleasure of partnering with Kathy and her team to bring them into the Fidelity Group family. It's been a privilege to join forces with Kathy. I'm excited to share today's agenda with you. Kathy will be covering the following topics. First, we'll be kicking things off with a common dilemma HR staff are encountering, which I'm sure you can all relate to. We'll then talk about some recent updates, followed by Medicare basics. This will serve as a strong foundation before Kathy covers helpful strategies and resources to share with eligible employees. Finally, we'll open it up for questions and answers. So starting off the HR dilemma, how did we get here? For the vast majority of people, the healthcare system, and benefits in particular, is a very confusing, complex maze. Most people spend the vast majority of their career accessing healthcare through their employer-sponsored health plans. This makes the role of the HR professional a critical piece of the healthcare system. And while we spend the majority of our careers relying on our employer-sponsored benefits, once we reach the age of 65 and shift towards Medicare, we are often left with very little in the way of resources and information about how to even start the Medicare process and how to make the best decisions for ourselves and our family. We at the Fidelity Group and CAS believe this can and should be different. We believe that all employers and HR professionals fall into unique positions to be able to empower working Medicare eligible individuals or those retiring and heading into the next phase of their lives to navigate the Medicare system in a way that's helpful to them and allows them to improve their decision-making power. We believe HR professionals are often left with very little in the way of resources, and our goal is to provide you with support and assistance to empower these individuals. And that is what today is about. We think this is an important conversation, certainly with Northeast Ohio and Ohio in general being what they are. Nearly 2.5 million residents are enrolled in Medicare, amounting to nearly 21% of the state's population. Ohio has a more robust Medicare Advantage market than many other states, with about 30 plans available in every county and more than 85 in some counties. That provides a great choice to Medicare eligible employees, but definitely adds to the confusion and complexity. We believe that makes this conversation extremely timely, and we're excited to share some valuable information. With that, I'd like to hand it over to our presenter, Kathy Hirko, to start with an overview of the HR dilemma.
Good morning, everybody. Thank you, Mary Kay. And thank you, everyone, for taking some time to be with us this morning. First and foremost, I'd like to say to you, this can be very confusing. We are going to do our best to try and simplify it. However, if you have questions afterwards, if you want to type them in, or if we end the presentation and you have questions afterwards, feel free to reach out to Mary Kay, and or you can reach out to my office. But please do not feel I should know this. This is a very confusing subject, and the Fidelity Group in CAS is working very hard to try and simplify it for you. Some facts. More than 78 million baby boomer retirees expected to exit the workforce in the next 20 years. The pandemic and inflation has had a profound impact on retirement. Almost half, 48% of those who plan to retire in 2022 are reconsidering or having put that plan on hold. I know this for a fact because people have met with us and said, we're going to delay retiring. And 40% of boomers plan to work until I drop, according to an AARP survey. 47% of Medicare beneficiaries and 57% of those nearing eligibility admitted they are overwhelmed at the idea of finding the right plan. This is very common and very normal. Many of those nearing eligibility don't know where to start, 47%, and say official resources like Medicare.gov are confusing, 51%. Thus, the CAS motto is, the more I read, the more confused I get. Ask us about the maze. 19% of Medicare beneficiaries enrolled in a plan without any outside help. And half of Medicare beneficiaries, around 51%, and 3 in 4 Americans nearing eligibility, 72%, will choose a plan based on affordability. Some Medicare updates for you. If you've not heard, although I do believe you have, because I know the Fidelity Group has tried hard to make you aware of the Inflation Reduction Act. The Inflation Reduction Act went into place in 2022. And every year there's been additional pieces that have been put into motion. Next year, in 2025, is the year that it will impact people who are on Medicare the most. And involved in the Inflation Reduction Act is what's called a prescription payment option. I'm going to explain that in the next few screens. But this Inflation Reduction Act may play a part in an employee's decision as to whether or not they should go on Medicare or stay on the company plan. What is the Inflation Reduction Act for 2025? Beginning in 2025, the Inflation Reduction Act, which you may see it referred to as the IRA, ensures people with Medicare Part D plans they will never pay more than a certain amount out of pocket per year on prescriptions. In 2025, that limit will be $2,000. That means that an individual who is on a Medicare plan will not pay any more than $2,000 the entire year. And if they meet that $2,000 in the spring, the rest of the year, they will pay nothing to pick up their medications. This is going to drastically lower the maximum cost from $8,000, which is what it is this year, often referred to as the donut hole or the coverage gap in catastrophic coverage. That is going away for next year. So the donut hole is going away. The max will be $2,000. Part D plan members will also have the option of paying their prescription drug costs in limited monthly installments. Over the course of each plan year, members will have an option through the Medicare Prescription Payment Plan, M3P they are calling it, provision, rather than paying it at the point of sale at the pharmacy. Let me simplify that. What that means is, if somebody has a couple of expensive medications, the Trilogies, the Humiras, things like that, and within the first 2 months, they are told 1 month it's going to be $740, and the next month they get to the $2,000, and the individual says, I can't afford that. I can't pay it all up front. They will have the opportunity and option to opt in to the payment program, which then the insurance company will take what they owe, divided by either if it's in January 12 months or if it's in March 10 months, and they will have a payment amount that will be the same every month. But please know, you don't have to explain this to an individual. That is not something that you need to do. That is why we are here, because it's confusing. It's very confusing. Just know that if somebody asks you, that does exist and we can help them. And the Fidelity Group will let us know that we need to explain that to them. Now that I've told you the updates, we're going to get into the basics of Medicare. What is it and who is it for? Medicare is a federal health insurance program eligible for U.S. citizens and legal residents. It is funded in part by taxes you pay while working. Many of you are probably aware of this. It is individual health insurance. It is not a family health plan. If a husband and wife are both eligible for Medicare, one can go on one plan and one can go on the other. It is not a family plan. It is also not Social Security. Many times people will say, I don't want to collect my Social Security right now, but I hear I can go on Medicare. Yes, they can. They do not have to collect Social Security to go on Medicare. It is not Medicaid. Many times people are confused by Medicare, Medicaid. Medicaid is low income. And Medicare is not free. No, it is not free. If somebody, as I'm sure many of you are aware, if somebody hasn't paid into it through work, then Part A does have a monthly premium. Now, if they have, Part A has no cost, but Part B, there is a monthly premium. And the monthly premium is determined by Social Security based upon their tax returns. Which leads us to the Social Security screen. Again, Medicare is not Social Security, but we do touch on this. Social Security consists of retirement, disability, and survivor benefits. People can start receiving benefits as early as age 62 or as late as age 70. You've heard of people say partial retirement amounts and full retirement amounts. That's what this is. Full retirement age depends on your date of birth. If somebody wants to know when their full retirement month is, they can log on to Social Security and it is listed there. I think we have it on the next screen also. The longer you wait, the higher your monthly benefit will be. If somebody chooses to collect Social Security prior to full retirement, they do lose 25%. If they wait and they don't get it at full retirement, it does increase right now by 8% every year. And you can get Social Security retirement benefits and work at the same time. However, depending upon if it's your full retirement or not, so as this is in the Social Security website, and this shows the year of and when their full retirement age is. And it does vary. And you can see literally by months. So who can get Medicare? Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You also must meet one of the following requirements. You turn 65. If you are younger than 65 with a qualifying disability, you can get it. And you can get it at any age with a diagnosis of end-stage renal disease or ALS. And you must have worked and paid taxes for at least 40 quarters, which is 10 years. So I want to go back to the disability statement. If somebody is collecting disability for 24 months, they are eligible for Medicare. So if an employee has a spouse or a dependent on the company plan and they're collecting disability and they hit that 24-month mark, they are eligible to go on Medicare. Many times people do not know this. Also, regards to the 40 quarters, I did have a lady ask me, I have 37 quarters, is it worth it to get my full 40? And I said yes. So many times people will say, I heard about this A, B, C, D, what is this? So when somebody goes on Medicare, they have Part A. Part A is hospital. Part B is medical. Now, Part A has no monthly premium as long as they've worked the 40 quarters and paid into it. Part B does have a monthly premium. It is based upon your tax return 2 years prior to when you start. So if you start Medicare B in 2024, Social Security is going to go back to 2022 and look at their modified adjusted gross income. Social Security will notify the individual as to what their premium is. If it is a higher earner, there will be higher amounts to pay for Part B. And that's something that we can go over with the individual. Part C is a Medicare Advantage plan. It is a type of plan that they can get to fill in the gap of what Medicare doesn't cover. And Part D is a prescription drug plan. And it is a requirement that everybody who's on Medicare does get a prescription plan. If they don't, they would be penalized unless they're on an employer plan that meets the definition of credible coverage. So what is Part A? And I'm going to touch on this. If you'd like a more detailed explanation, feel free to send it into the questions. Part A is inpatient hospital care, home health services, skilled nursing facility care, and a hospice. Again, it is premium free. Yes, there are deductibles and copays, and you can't be denied coverage. Part B is medical. Doctor visits, outpatient services, preventative services, medical equipment, some home health visits. Again, there's monthly premium. Yes, there are deductibles and coinsurance. It covers 80%. Traditionally, that's what we do, is we help them find an option to cover the 20%. They cannot be denied coverage. You pay monthly from Social Security, EFT, credit card, or check. So what does that mean? If I am collecting Social Security, they will deduct my monthly premium from my Social Security payment. If I am not collecting Social Security, CMS will send you a bill for that monthly payment, and then you can do it by EFT, credit card, or check. And if somebody is eligible for Medicare and they do not have an employer plan that's defined as credible coverage, when they go sign up for Part B, they would get a penalty for late enrollment. That's why you heard Mary Kay stress the credible coverage. As I stated, Medicare does not cover everything. It does not cover prescription drugs. It does not cover dental, vision, or hearing. Eyeglasses and contacts or hearing aids. It also does not cover long-term or custodial care. Activities of daily living. When we meet with somebody, we stress Medicare covers what's defined as medically necessary. If it's not defined as medically necessary by the provider, the doctor, Medicare will not cover it, which is why dental, vision, and hearing are not covered, because in the eyes of Medicare, it's not defined as medically necessary. And there are excess charges for services by doctors who don't accept Medicare assignment. And care received outside the U.S., except for certain circumstances, are not covered. So people will say, I have somebody who's ill. Medicare will cover if they need bathing or transferring or no, that is not. That's considered activities of daily living. What we are showing here is how much Medicare costs, the deductibles, so on and so forth. These are 2024 numbers. I tried to find the 2025 numbers, but I do not believe they've been released yet. So Part A, again, has no cost. The deductible is $1,600 per benefit period, up to 60 days. Again, we sit with somebody and help them. How do they cover that? There are additional costs, $400 per day for days 61 through 90 in one benefit period. So if somebody's in the hospital longer than 60 days, they are going to incur some costs. And then if they still go past that, there is an additional $800 per lifetime reserve day. But there is no out-of-pocket limit for coverage. Part B. Again, these are 2024 numbers. The sweet spot for the monthly premium is $174.70 a month. That is what an average individual will pay for Part B. And if they have Part A and Part B, they have 80% coverage. There is a deductible, and the deductible this year is $240. So no matter what, if you go to the doctor, you go for an MRI or CAT scan and you haven't paid anything, you're going to have a deductible of $240. Part B covers 80%, so you have the other 20% unless you are on a plan to go with the Medicare. And there is no out-of-pocket limit. What do people do to help them fill in the 20%? Well, they have option one, which is a Medicare supplement, sometimes referred to a Medigap. If somebody says I'm on a Medigap, if somebody says I'm on a Medicare supplement, they are on the same type of plan. It helps pay some of the out-of-pocket costs that come with original Medicare. And then they need a Part D prescription plan. So they would have 3 cards. They'd have their Medicare card, their insurance card, and their prescription card. Or they can go on an Advantage plan. And the Advantage plan is referred to as Part C. So if somebody says I have Part C, somebody says I have an Advantage plan, they are referring to the same thing. Part C combines Part A hospital insurance and Part B medical insurance all in one. And in this area, many include the Part D prescription coverage, so they do not need another Part D plan, and they've met their requirement of having a credible coverage Part D. These are offered through private insurance companies. And there are many options. Ohio happens to rank number 6 of all the states with Medicare eligible people, with many of them living in Northeast Ohio. So there are many options. That's a good thing, but that can be a confusing thing. What is Part D? It's the prescription drug plan, but we traditionally tell people, because they get confused, it's the drug plan, D for drugs. It is a requirement since 2006 that anybody who goes on Medicare, whether or not they take any medications, do have to get a Part D prescription plan. If they don't, when they do go on one, they would pay a penalty, and they pay a penalty the rest of their life. The average Medicare member takes 4.2 to 4.5 prescriptions per month. They can be offered through a standalone prescription plan or through the Advantage plan. They do have network pharmacies, and now they have preferred pharmacies. Network pharmacies have negotiated lower copays with the carriers. Preferred pharmacies may have additional lower copays than the network pharmacies. They are offered through private insurance companies, Anthem, Aetna, United, Medical Mutual, so on and so forth. They do have a monthly premium. Prescription copays, people can count on prescription copays when they go pick up their medications. And some of your lower premium plans will have a deductible. Some of your higher premium plans may not. If an individual loses their credible coverage, they have 63 days to join a Medicare Part D plan to avoid a late enrollment penalty. So if somebody comes off of an employer plan and forgets to get a Part D plan, they have 63 days before they will incur a penalty. There are various enrollment periods when somebody is turning 65. They have 3 months before, the month of, and 3 months after. So it's a 7-month window. And it is considered a qualifying event if they are on an employer plan and they want to come off.
Kathy, when does the coverage start? Does it start the first of the month of my birthday when I turn 60, when I apply for Medicare, or is it the following month?
That's a very good question. So if you apply 3 months before, it's not going to start until the first of the month that you turn 65.
So if I turn 65 on the 15th of the month, it'll start on the 1st.
Correct. Now, if you are 65 or after 65 and you're doing the 3 months after, it will start the month after you apply. But many times people will say, I want to get it signed up and beforehand, which is fine, but it does not start. I have people, even if their birthday's on the 28th or 29th, it's going to start the first of the month if they turn 65. When can I enroll? Medicare supplement, initial enrollment period. So once somebody gets their Part A and Part B, they have 6 months after the month you turn 65 or you enroll in Part B. You are guaranteed issue. There is no medical underwriting if you enroll during that time. You can enroll in a plan later, but you could be denied or charged more based on health history. So you do go. If you miss your 6-month window, you can still apply for a Medicare supplement, but you may have to ask medical questions, and depending upon your answers, it may take the monthly premium up higher, and there are a few scenarios where you could be denied.
So, Kathy, if I continue working after 65, are there medical questions then?
If you're new to Part B, so I'm 68 or I'm 69, but I'm just getting my Part B now, as long as you do it within that 6-month window, you're fine. You're fine. Special enrollment period. Working past 65. Okay, so the month after the last month of employment or employee health coverage. You have 8 months to enroll in Part A and B before you're going to have to wait to, I think it's January now because they moved it for the enrollment period. It's called general enrollment. So somebody has 8 months to get their Part A and B. But they have 2 months to enroll in a Medicare Advantage plan or a prescription drug plan. Why? Because you have 63 days from the day your plan ends. So if I'm getting a Medicare Advantage plan that incorporates my Part D prescription coverage, that's why it falls into that 2 month. Well, 63 days is 2 months. I don't know where they came up with the extra 3 days.
Kathy, you talk about Part A. If I am still working and on my employer plan, am I eligible to enroll in Part A at any time?
You can enroll in Part A at any time. However, if you have an HSA and you enroll in Part A, you can no longer make contributions to it, and or your employer, if they are making contributions, they can no longer make contributions. You can use the money that's in it, but you can no longer make contributions. And that is to be stopped, I believe it's 6 months before, if you have an HSA, before you would enroll in Part A.
So there's no cost to me to enroll in Part A, but if I have that coverage, my group health plan would coordinate with if I have a hospital stay.
Correct. And if there are less than 20 employees, Medicare does require that an individual gets Medicare A and B when they turn 65, because Medicare becomes primary and the employer plan becomes secondary. But if there's over 20 employees, the individual does not have to go on Medicare because if they did, the employer plan is still going to be primary and Medicare would be secondary after that. As long as they have credible coverage and it's over 20 employees, they do not have to go on Medicare. We touched on HSAs. You can contribute to an HSA up to 6 months before enrolling in Medicare. And again, this refers to Part A. You don't necessarily have to get the Part B, but as soon as you enroll in Part A, to be able to contribute to an HSA after age 65, you must not enroll in Medicare. At age 65, you can take penalty-free distributions from the HSA for any reason. However, in order to be both tax-free and penalty-free, the distribution must be for a qualified medical expense.
You can contribute to an HSA until you enroll in Medicare, even when you're not working. You can continue to withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses such as deductibles, premiums, co-pays, and co-insurance. So you can use the money that's in your HSA, you just can no longer contribute to the HSA. FSA accounts working past 65. As long as you are employed, you can continue to make contributions to your FSA through payroll deduction. Medicare is not a determining factor like it is with the HSAs. Once you turn age 65, you can also use your account to pay for things other than medical expenses. You can use funds from your health care to pay for eligible medical costs for both your spouse and tax dependents, regardless of the medical insurance in which they are enrolled. For example, Medicare. Okay. Decisions for Medicare eligible workers. This is many times the confusing part. Sometimes people say, I get all this literature in the mail and I ignore it, and others say, I try to read it and I don't understand it. Okay, so people who are turning 65 and working for an organization with fewer than 20 employees, they do have to enroll. That is a Medicare requirement. Those working at organizations with 20 or more, they can choose whether to enroll in Medicare before retiring. Now, these are the options. Okay, they can keep the employer-provided group coverage and decline to enroll in Medicare. Enrolled in employer's high deductible health plan can continue making HSA contributions. After employment ends, enroll in Medicare Part A, Part B, and Part D, or a Medicare Advantage plan within 7 months, or pay premium penalties. We touched on that. They have the 8-month window that they can do it. Or they can enroll in an employer's plan and in Medicare Part A because they're not going to have to pay a premium. Part B, they would have a premium or purchase a Medicare Advantage plan. They do have to stop making those HSA contributions, and they would receive secondary coverage through Medicare for doctor visits, hospitals, and prescription drugs. Or they can enroll in an employer's plan and in Medicare Part A and decline Part B and D because there are those monthly premiums. Again, they would still need to stop making the HSA contributions. For hospitalization, they would receive primary coverage through their employer plan and secondary through Medicare. The employer plan alone covers doctor visits and prescription drugs. After employment ends, they would enroll in a Medicare Part B or Medicare Advantage plan within 7 months, or pay premium penalties after and perpetual. I can't talk. I'm talking too much. I'm just going to simplify this. They would after the employment ends, they would enroll in Part B and then a Medicare Advantage plan within the 7-month window to avoid paying penalties. If they didn't, then they would pay penalties after the late enrollment period.
Kathy, we had a question in the chat regarding Part A. If someone does not enroll in Part A when they turn 65, is there a penalty on that?
No, there is no penalty. It's the penalty is related to Part B. So you can delay Part A. When can I change my coverage? Okay, this is once somebody is on a Medicare plan. Many times people think I'm turning 65 or I'm coming off of an employer plan. I have to abide by the
what we call the annual enrollment period, which is every year between October 15th and December 7th. And I'm sure you all have seen the commercials. You are inundated with the commercials. This is for somebody who's already on a Medicare plan. This is when they can make a change. Just like when you're on your employer plans, you can change once a year. This is when those on Medicare can change. They can switch from original Medicare Part A and B to a Medicare Advantage plan, or vice versa. They can switch from one Medicare Advantage plan to another, or they can join, switch, or drop a Medicare prescription Part D plan. And that's where we can help them. We can help them understand what their options are at this particular time of year. It can be very confusing for people. If somebody does want to make a change, though, they do need to make it by December 7th, and it will not go into effect until January 1st. Yes, there are additional enrollment periods. There are special enrollment periods. You can make changes to your Medicare Advantage and your prescription drug coverage when certain events happen in your life. Rules about when you can make changes and the types of changes you can make are different for every special enrollment period. There are a multitude. I'm 68, I'm 70, I'm just leaving my employer plan. Or I just inherited money. My mother just moved into a nursing home. I just moved out of a nursing home. I was living in Ohio and I'm retiring and I'm going to live in Florida. Those are all special enrollment periods. Those are things you do not have to worry about. Just know that they exist and we can help the individual understand the enrollment period option and the timelines with them. There is another enrollment period called Medicare Advantage Open Enrollment. Annual enrollment is going on now. People can change a plan every single day, but whatever paperwork is in on December 7th will be the plan for the next year. Open enrollment is not advertised. But if somebody's on a Medicare Advantage plan, they are allowed to change a plan one time between January 1st through March 31st. It's only one change. And it's Medicare Advantage Open Enrollment is only for people who are currently enrolled in a Medicare Advantage plan. And they have to initiate the question as to whether or not they want to make a change. We are not allowed to advertise it. We are not allowed to make phone calls about it because that's considered soliciting and we are not allowed to do that. Okay, so how can you help? You can review your benefits program, conduct a data analysis. I can't talk this morning. Anyways, what does that mean? So many times when people are Medicare age, we'll say you can educate yourself by looking at your company plan versus if you opt out and go on Medicare. Or if your spouse is turning 65, if the spouse opts out of the company plan and looks at going on Medicare. In addition, with the out-of-pocket drug costs capping at $2,000 next year, that may play a part into whether or not somebody stays on an employer plan because it depends on the medications they're on and will they be better off with lower costs for medications if they opt out of the employer plan or stay on the employer plan. There is support. Provide Medicare and Social Security literature and handouts. There's a ton of them. And if there's something in particular you need, I'm sure if you reach out to Mary Kay, we would make sure that you did have it. And we can encourage a Social Security account. Why? Because that people can go on those Social Security accounts. They can set up, even if they don't want to collect Social Security. And it does help employees understand how the company's retirement program works. If you want to tell your employees where to go, they can go to Medicare, medicare.gov. They can go to Social Security, socialsecurity.gov. But I will tell you that if you call Social Security to ask about Medicare, they're going to tell you to call Medicare. If you call Medicare and say, I want to sign up for Medicare, they're going to tell you to call Social Security. So they do make it rather confusing. There is the State Health Insurance Assistance Program. They can help people understand some of this. They are traditionally volunteers who have been trained. They're not certified, so if somebody wanted a deep dive into the plans, they may not be able to do it. Or they can call Cas Company or call the Fidelity Group. And just information for you, everybody on my team, we have to recertify every year for every plan that we represent. And if we do not get a certain score, we cannot talk about the plan the following year. So Medicare does require that we do a lot of homework before we can talk about the plans.
Kathy, we had a chat question. Is there a fee for using CAS? And also, can you explain the process that you go through with an employee when they call you?
Sure. Number one, there is no fee. There is no cost. There is no obligation for us to either meet with an individual one-to-one, or if somebody wanted what we call a Medicare 101 at your office. How do we get paid? If somebody chooses to go on a plan through us, the plan pays us. The individual does not pay us. So if you wanted us to come in and do a little presentation, there's no cost. And if the individual wanted to meet with us, there's no cost. We do comparisons for individuals all the time. And the second question was?
What the process is. What do you need to them to bring to the meeting? Or
so if somebody says, I'd like to do a comparison, we do ask them to bring an outline of their plan, what they're paying. Is there a deductible? What is it, a 80-20? Is it an HSA? So that when we meet with them, we can show what their costs and exposures are for their current plan versus if they're gonna, then we can show them the cost to opt out and go on Medicare. And it is not required, but we do recommend if they could give us a list of their medications, because if somebody's on low costing, people can be on 10 meds and think that they're going to pay a lot, and they may not. And some people can be on 3 meds and think they're not going to pay a lot, and they will. So we like to ask people to incorporate what medications so we can incorporate in potential costs for the individuals.
we have a couple questions here. First one, can I use HSA monies to pay for premiums for Medicare? Kathy, do you want me to take that one?
Sure, you can.
Okay. Any money that's in the HSA, you can use to pay for Part A, Part B, and Part C Medicare Advantage plans, and Part D, but not Medigap premiums. So hopefully that answers that question. I also had a question, can I reimburse Medicare premiums for my employees? Medicare secondary payer rules prohibit employers from creating any incentives, monetary or otherwise, to encourage individuals to transition away from the employer-sponsored plan. However, if you have less than 20 employees in your company, you can establish a Medicare HRA, health reimbursement arrangement, so that you can help provide funding. And that HRA is something that the Fidelity Group would be able to help you work through. So if you have over 20 employees, you cannot provide any incentive to encourage people to go on to Medicare. If you are under 25, we would be able, or under 20, we would be able to help you establish an HRA that you could provide funding. We also had a question, if I have a high deductible 4,000 plan now, and in 2025, the maximum for Part D is 2,000, do we still have creditable coverage? The creditable coverage rules are being sunsetted until 2026. Your plan might not be considered creditable now, but there will be no penalty. The creditable coverage notice that you send out now, if you're creditable in 2024, it will be creditable in 2025, and then in 2026 is when the penalties for not having creditable coverage will begin applying.
There is another question here. Does CAS have access to all plans available from all outside insurance companies for Part C? CAS company represents a multitude of the plans, and we are contracted, licensed, and certified with the major carriers. However, some of the small carriers we are not contracted with, but if there was a particular insurance plan that you were interested in, we could research and find the information for you. So we are with many, many, many of the major companies. It's some of the regionals that we may not represent at the moment, but we can find out if there's one in particular you were referring to.
I have another question. What options are available for my family if I go on Medicare, since they're currently on my medical plan through my employer? If that is a situation where the employee is eligible for Medicare but has dependents on the group plan, the dependents can go on COBRA. We also could work with them the Fidelity Group could work with them to help them find individual coverage on the marketplace. And they also might consider looking at if the spouse is working and the spouse has a plan. As you know, dependents are covered until age 26. So if the spouse has a plan, they could consider going on the spouse's plan. So there would be options for them if CAS company determines that that's best for you and your family, for you to go on Medicare.
And if we did a comparison for you, we would incorporate the cost if your family or your spouse needed a separate plan. We would incorporate that into the comparison so that you would see all of the various costs before you made a decision.
Thank you for joining us. If you have any additional questions, please contact the Fidelity Group or Kathy at CAS. She would be happy to set up appointments with your employees. She would also be happy to set up group meetings. She has 23 agents that work with us. And they can come to your company and do meetings, group meetings, or they can meet individually with people, either at your company by phone or discuss another method easiest for them. So this is when people turn 65. This is such a confusing area, and we're very glad that we do have CAS to help us through this. So please be sure to reach out if there are any questions.
And if I can add, if you have employees that are coming to you for help because their parents are asking for help, or somebody in their family says, can you help me? And it's taking away from your employees' work time, we can help them. And we've done presentations to 2 people, and we've done presentations to 35 people or 40 people. There is no requirement. But if you, the goal here, both by the Fidelity Group and by CAS, is to make your life easier and take away a little bit of confusion for yourself and also your employees.
So thanks everybody. Have a great week and feel free to reach out if we can help with this.